Welcome to Point of Care Testing Section SARS-CoV-2 Antigen Test. Our learning outcomes is to present an overview of POCT definition and policy, explain purpose of using PCL, demonstrate the measuring principles of the analyzer and specimen requirements, demonstrate system components of PCL, aware about the consumables like storage, stability, and disposing. Demonstrate the quality control test. Demonstrate processing patient specimens and results review. Demonstrate the maintenance. Aware about proficiency testing. POCT, or the point of care testing, are tests designed to perform outside the physical facilities of the clinical laboratories. This is performed by competent certified and authorized non-laboratory personnel. POCT policy is under CL 7211. The purpose of performing POCT COVID-19 antigen rapid test is to screen patients prior to medical procedures and to facilitate quick patient management in emergency departments and critical care units. PCL COVID-19 AG rapid test is using an in vitro diagnostic medical device called FIA, or the fluorescence immunochromatographic assay, intended to be used to qualitatively detect SARS-CoV-2 antigen in human nasal, oropharyngeal, and nasopharyngeal specimens. The measuring principle of PCL COVID-19 AG rapid test is when the sample contains a SARS-CoV-2 antigen, the antigen-antibody immune responses form double complexes that appear fluorescent. However, if it turns negative, it does not form a double complex in the test region. In addition, regardless of the presence or absence of SARS-CoV-2 antigen in the sample, the fluorescence will appear in the control region of the test card. There are three types of specimen that can be collected for this test: human-dried nasal, the nasopharyngeal, and the oropharyngeal. However, the nasopharyngeal specimen will be the standard specimen for this test.
This is the testing kit. It contains the following. First, the nasal or nasopharyngeal swab. Next is the oropharyngeal swab. It contains 25 pieces of extraction buffer solution tubes. And this is how it looks like. It also contains 25 pieces of filter cup. And 25 pieces of test cards sealed in each one box. And of course, one ID chip. So always remember, when opening a new test kit, you should always use a new ID chip. These are the consumables. The testing kit must be stored at room temperature up to 30 degrees Celsius in a dry place. When opening, the staff should indicate the opening date and the staff initial on the used testing kit. The expiration is still the manufacturer expiry date that is indicated on the kit. This is the PCL machine. It is touchscreen. This is the ID chip port, the test device port, and the printer. Now, this is how you open the printer area. Now we will show you the difference between QC card and the testing card. This is the QC card. It has quality control card written on it. And this is the test card, which is used in running the samples. The QC card has a double colored line on it. Meanwhile, the test card has nothing. Please bear in mind that the test card should be used immediately after opening the pouch within 1 hour, and the QC card expiry date is 10 years as per the manufacturer. When using the machine, please make sure that the ID chip is inserted into the port. If not, you'll have to insert a new ID chip. Press Read ID chip on the screen. Read successfully message will appear on the screen. Your machine is now ready to use. For the quality control, we will use the QC card. You will have to insert the QC card into the slot. Choose System from the main screen. Choose Self-Test. The QC will check the following: transmission, barcode system, optical system, electric circuit system. Now you press the In button. Press Start. All normal message will be displayed. You can now proceed with patient testing. In collecting and processing patient specimen, please make sure that you are wearing full PPE. Insert the collected swab specimen into the extraction buffer tube. Spin the swab 10 times while moving it up and down. Close the extraction tube with filter cap. Please make sure to create a tight seal. This is the test card. This is where you will place your thumb to hold the test card. And this is the sample well, where you will place the sample mixture. This is the test region, where the fluorescent will appear if the sample turns out to be positive. Dispense 3 drops of the sample onto the sample well of the test card. Insert test card into the device port. Press Test, then click Detailed Information to enter patient demographics. Scan operator ID with scanner in operator. Scan patient HC number in patient number and patient name. When the information is ready, click Yes. This machine offers 2 types of tests, the standard and the quick one. But we should always use the standard test. Standard test will give you the result after 10 minutes because it takes time to incubate the sample inside the machine prior to reading the actual result. Meanwhile, for the quick test, the machine will automatically read the sample and will give you the result. Incubation period will take place outside the machine. Now press the sample type. We will choose the nasopharyngeal swab. Now press Start Test. Runtime is 10 minutes. Countdown will be displayed on the analyzer screen, and results will be displayed as either positive or negative. Results will be transmitted automatically to Cerner. Five, 4, 3, 2, 1. When the result is ready, you can press print to print the result. To manually send the result to Cerner, you can press History, select the result, and press the List button, LIS, to send it manually. For the specimen rejection criteria, we have unmixed specimen, wet test device window, insufficient sample, inaccurate test time. This is how you will dispose the consumables. And this is the daily checklist form. Thanks for watching!